Tuli farahi sana kwa kuweza kutumika pamoja na no confrère congolais avec des malades à l'hôpital Panzi à Bukavu on Congo. But no matter what language we're talking, whether Swahili or French or English, we had a powerful experience last week. I'm Phil Fischer from General Pediatrics here at Mayo, and last week I was able to join with the Mayo team of women's health doctors and surgeons as we went to the Congo, Democratic Republic of Congo, to help deal with some health problems there. As a pediatrician, I spent most of my time teaching pediatrics, while the rest of us on the team were dealing with women who had been the victims of sexual violence and rape, and also dealing with people who had suffered from obstetrical trauma and had life-limiting problems because of all that. It was pretty fascinating to be working in the Great Lakes region of the Congo. I'd had the privilege of living a little bit north of this place for 6 years earlier in my career, and so it was personally fun to be back, see some people I knew, and work with colleagues that knew other people with whom I had worked. We were able to work in a place that's been the site of war and civil unrest for decades already, in an area that sadly is known as the rape capital of the world. But while my colleagues from Mayo were working with surgeons and working in the gynecology clinics, I was off with medical students teaching pediatrics. After our morning report each day, we would spend a few hours going from bed to bed, seeing children that were hospitalized. We made these out as teaching rounds, talking about the problems that the kids had, how in that setting we could make a good diagnosis, and how we could give appropriate treatment to help. We saw children with malaria and pneumonia, children with meningitis. We saw a young woman with tetanus. We saw people with urinary tract infections. We saw people with complications of injuries and congenital malformations. And in each case, we did it as a teaching sort of a time. Initially, there were a few students with me around the bedsides, but these students were enthusiastic about learning. These were senior medical students, the 7th year of their training by their local structure of education. And these senior students were hungry to learn and loved learning. Our little group of 4 students with me around a bedside swelled till we were filling the room with 15 or 20 people at a time. We went from bed to bed and had good discussions about how to care for patients and how to deal with particular diseases. And then in the afternoons we'd get together in a lecture hall for a couple more hours for some interactive teaching, talking about anemia and malaria and diabetes and coma and other problems that are common there that we could help take care of in children. By the afternoon we grew beyond the 22 students on their pediatrics rotation and had other students joining us well to fill the lecture hall with good times of discussion. And I was impressed by these students. They were bright, they were committed, they had experience, and they were hungry to learn. Seeing these students gave me great hope for the future of the Congo. It helped me realize that there's a lot that can be done, even though there are needs, even though there's been civil unrest. There's a new generation of trainees, of medical students and residents. And this new generation is coming along, working hard, hungry to learn, learning a lot, and increasingly being committed to the good of their patients. It was a great privilege to be with the Mayo team working there in the Congo.